Hi, this is Katie Jalbert. I'm going to be giving my presentation on the eye. Here is my diagram. I will also be submitting a picture of this diagram in with my assignment. The eyeball, also referred to as the globe, is made up of three layers. The outermost layer is tough and it contains the transparent cornea along with the sclera. The choroid, iris, and ciliary body, also known as the uveal tract, make up the middle layer, while the retina comprises the innermost layer. The anterior cavity is separated into the anterior and posterior chambers. The anterior chamber is found between the iris and the posterior surface of the cornea, while the posterior chamber is situated between the anterior surface of the lens and the posterior surface of the body. The large space posterior to the lens is the posterior cavity. Color is provided to the eye by the iris, as in blue right here on the picture. In the center of the iris, there is a small circular opening known as the pupil, where light is permitted to enter the eye. Constriction of the pupil occurs as the action of the sphincter muscle of the iris, and it dilates by way of action from the iris dilator muscle. This allows for a controlled amount of light to enter the eye. The lens, located posterior to the iris, is avascular, biconvex, and transparent. The main function of the lens is to bend rays of light so they are able to focus on the retina. When the eye focuses on a nearby object, accommodation occurs. The ciliary body contracts, thus changing the shape of the lens. The ciliary body is made up of ciliary muscles that surround the lens and are found parallel to the sclera. The ciliary processes are found posterior to the peripheral area of the iris, and they are responsible for secreting aqueous humor, while the highly vascular structure known as the choroid provides nourishment to the iris ciliary body as well as the section of the retina that is found parallel inside the sclera. The innermost layer of the eye, known as the retina, extends and shapes the optic nerve. A large portion of the retina is made of neurons, and if destroyed, they are incapable of regenerating. The eyeball is lined with the retina, and it continues to extend from the optic nerve to the ciliary body, and it is accountable for taking an image and converting it so it can be understood by the brain through the process of vision. Two variations of photoreceptor cells known as cones and rods compose the retina. Cones are responsive to colors in bright environments, while rods supply vision in dim or darkened settings. The macula consists of a 6 mm diameter area within the central area of the retina that is accountable for the central vision field. The fovea centralis is the location of the retina that supplies the visual acuity that is sharp. This is essential for activities involved in detailed visual, such as driving or reading. Three major eye-related diseases that affect the adult population are dry eye syndrome, macular edema, and diabetic retinopathy. Dry eye disease is a chronic condition of the corneal surface marked by persistent symptoms of irritation or burning that can lead to inflammatory damage to the cornea and conjunctiva if untreated. Some of the common risk factors for incurring this type of syndrome include advanced age, female sex, low humidity environments, systemic medications, as well as autoimmune disease disorders. Diagnosis of dry eye syndrome is achieved through a comprehensive eye exam, tests to measure the volume of tears, such as a Schirmer test, another exam to determine the quantity of tears, a tear osmolarity test, as well as tear samples to look for markers indicating dry eye disease, including elevated matrix metalloproteinase 9 or decreased lactoferrin. Treatments to relieve symptoms include tear replacement, humidification, improved nutrition, as well as anti-inflammatory ocular agents. Some of the nursing management and interventions that can be performed relating to dry eye syndrome is to apply warm compresses to the eyes, as well as to initiate a physician referral if needed for more aggressive treatment. Consistent management of this condition can improve quality of life as well as minimize damage to the ocular surface. Nursing education may include suggested nutritional strategies by increasing omega-3 fatty acids into the diet of the affected individual. Foods such as flax seeds, walnuts, edamame, kale, spinach, whole grains, and legumes can provide essential nutrients to clients affected by dry eye syndrome. Macular edema involves the macula, the central region of the retina, and an accumulation of fluids inside the macula, resulting in swelling and thickening of the macula, leading to vision distortions. Since the retina is richly populated with blood vessels, abnormal leakage of blood from damaged blood vessels can result in blood accumulation within the macula. Any eye disease damaging retinal blood vessels can lead to macular edema as well as inflammatory diseases. The patient may experience wavy or blurry vision in or around the central field of vision, as this is considered one of the initial symptoms of macular edema in many cases. Some individuals may also experience colors appearing washed out or faded, as well as a significant vision loss may be experienced. If macular edema affects only one eye, blurriness in both eyes may be experienced until treatment is achieved. Macular edema is diagnosed in one of three ways: through dilation during a retinal exam, fluorescein angiography, or through optical coherence tomography. Treatment for macular edema is dependent on the underlying causes of the disease as well as the consequential fluid leakage and swelling of the retina. Treatment may include nonsteroidal anti-inflammatory eye drops, steroids in pill, eye drop, or injection forms, laser treatments to the regions of leaking fluid, antivascular endothelial growth factor known as anti-VEGF drugs, and vitrectomy surgery. Some of the nursing management and education that can be provided to those individuals suffering from this disease include providing a nightlight for the patient so that they are able to see in darker areas, and promote safety and encourage clients to visit an ophthalmologist yearly so that preventive measures and early detection can occur. Diabetic retinopathy is the leading cause of new blindness among adult Americans. It is also a significant cause of vision morbidity in the elderly population. The prevalence of diabetic retinopathy rises with increasing duration of diabetes. Although it may be observed in the elderly at the time of diagnosis or during the first few years of diabetes, diabetic retinopathy can be characterized by abnormalities relating to retinal circulation, including microaneurysms, cotton wool spots, intraretinal hemorrhages, retinal edema, exudates, and intraretinal microvascular abnormalities. Treatments for diabetic retinopathy include intensive glucose control in reducing the development and progression of diabetic retinopathy in patients with type 1 and type 2 diabetes. Control of hyperlipidemia, hypertension, fluid overload states, and renal failure may all contribute to further reducing the adverse effects of diabetic retinopathy. Surgical options are also available for treatment, including laser therapy, panretinal photocoagulation, and vitrectomy. Some of the nursing management and interventions may include nursing education in regards to managing diabetes and keeping blood sugar and blood pressure under control. The nurse can include keeping a log of blood pressures and blood sugar levels and review them for area of improvement. Encourage the patient to have an annual eye exam and to contact physician if changes in vision occur. Promotion of a healthy diet and exercise program in order to prevent further deterioration due to diabetes is also encouraged. Encouraging the patient to take their medications as directed, and if the patient smokes, encourage smoking cessation and education to the client that there is less oxygen available to reach the retina when the client smokes. Three major age-related diseases that affect the geriatric population are glaucoma, cataracts, and age-related macular degeneration. Glaucoma occurs when the pressure within the eye is elevated. This can cause damage to the optic nerve, resulting in vision loss and blindness. As many as 1 million people have glaucoma without even realizing it, as there are no symptoms found initially. But as the disease progresses, an individual with glaucoma may begin to notice their peripheral vision gradually failing. If left untreated, tunnel vision may occur. Several tests are performed along with a comprehensive eye exam and a medical history. Some of the tests performed may include tonometry, including intraocular pressure, tests to determine optic nerve damage with a dilated eye exam, as well as imaging tests, visual field tests, pachymetry, a measurement of the corneal thickness, and gonoscopy, an inspection of the drainage angle. The damage caused by glaucoma is irreversible, but treatment with regular checkups can aid in slowing and preventing vision loss if caught within the early stages. Glaucoma is treated by decreasing the intraocular pressure, and depending on the situation, options may include oral medications, eye drops, laser treatment, surgery, or any combination of these. The nurse can educate adults from identifying signs and symptoms of blurred vision, as well as encourage yearly eye exams as a form of secondary prevention. Interventions that the nurse can be involved in with glaucoma is to give medications as ordered. Cataracts are among one of the most common causes of vision impairment among the elderly and the most common cause of blindness worldwide. The prevalence of cataracts increases with age from less than 5% in individuals under 65 years of age to close to 50% in those 75 years of age and older. Cataracts frequently are referred to as lens opacities that interfere with the vision function. Clients with visually significant cataracts complain of blurred vision or glare. Progression of the cataract is gradually slow, with a gradual visual loss over a time period of months to years. Cataracts are associated with central lens opacification. The nucleus loses its transparency and a yellow or brown discoloration may develop. There are multiple varieties of cataracts, from nuclear cataracts, cortical cataracts, to posterior subcapular cataracts. Diagnosis of cataracts occurs during an eye exam where a visual acuity test, use of the eye chart to measure where an individual can read a series of letters is performed. A slit lamp examination also allows the physician to visualize structures at the front of the eye under magnification, or through a retinal examination where drops are placed into the eye to initiate pupil dilation, making it easier for the physician to examine the eye with an ophthalmoscope. By doing this, he is able to examine the lens for signs of cataracts. The only effective treatment for cataracts is surgery. Some of the nursing management or health promotion for cataracts may involve instructing the client to cease smoking, as it is one of the largest contributing factors to cataracts. Another way the nurse can teach the patient is to encourage wearing of sunglasses, thus shielding the eye from overexposure to UV rays that predispose the client to cataracts. One of the leading causes of loss of vision among individuals over 65 years of age is age-related macular degeneration. Age-related macular degeneration is characterized by degeneration of the macula, the area of the retina that is responsible for central vision. Some of the risk factors associated with this disease include advanced age, family history, as well as cardiovascular risk factors related to hypertension and cigarette smoking. Approximately 90% of individuals diagnosed with age-related macular degeneration will have the non-exudative form of the disease as it is the most common and it accounts for only 10 to 20% of cases of severe loss of vision. Drusen are lo- localized deposits of extracellular material that becomes concentrated in the macula. The yellowish-white deposits tend to be symmetric in number and distribution and occurs in both eyes. Geographic atrophy is responsible for almost all of the cases of severe vision loss, and it is characterized by round or oval patches of atrophy of the retina, retinal pigment, epithelium, and underlying choroid. As time progresses, these patches may increase in size as well as numbers. Patients may experience blurred or distorted vision, difficulty reading or driving, or have an increased dependence on brighter light or magnifying glasses to perform tasks that require fine visual acuity. Diagnosis of age-related macular degeneration is accomplished through an annual dilated eye exam where the physician may identify the presence of drusen as well as pigment changes of the macula. Standard screening tests include a visual acuity exam as well as an Amsler grid, fundus fluorescein angiography, optical coherence tomography, fundus autofluorescence imaging, and genetic testing can all be performed to diagnose age-related macular degeneration. There is no current cure for age-related macular degeneration, but treatments available may slow the disease process and prevent severe loss of vision. Some of the treatment options available include anti-angiogenic drugs, laser therapy, photodynamic laser therapy, and vitamins. Nursing management is mostly educational by encouraging the patient to provide ample lighting at home for activities of daily living, encourage the use of vision aids, and encourage patients to receive yearly eye examinations. Health promotion is to encourage medication administration, yearly eye examinations as well, and to encourage the patient to consume foods containing vitamin C, E, beta carotene, zinc, and copper. Once again, thank you.